welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Sylvia Belda. She is a pediatric intensivist in Spain, and she wrote the KevinMD article, "A Dead Baby in My Arms." Sylvia, welcome to the show.
Thank you very much. It's so nice to share the space with you.
So we'll get into your story and article in a little bit. First off, just briefly share your story and journey to where you are today.
I'm a pediatric intensivist, and I work in an intensive care unit here in Madrid, in a pretty big hospital for the Spanish country. We have patients up to 16 years, and we have an important cardiac surgery program and also one of the first ECMO programs in the country. And I always have thought that the intensive care unit environment is pretty fascinating. It offers a big challenge, both scientifically and technologically, and we have so many possibilities and constant innovations. And I love the challenge of keeping abreast of the latest developments and trying to offer the best possibilities to the children we attend. And keeping up to date and reading and studying in this profession that's always evolving is my passion. But I also have always felt that being surrounded by this environment also helps me to keep my feet on the ground. Mm-hmm. I think we live in a society that lives with its back turned to death, where it seems that we always have to be young, and I think dying is taboo. And in this context, especially the illness and the death of the children are kept silently ignored. And I've always considered that living with death present in my daily life and accompanying these situations in first person helps me to live my own life better. No? So I think one of my passions since I started is just taking care of people. No? It has been key for me, and I think it made me choose my profession, and it also marks my fields of interest. No? And I'm pretty aware that we invest an enormous time and effort in medical training. No? We are constantly keeping up to date and question the diagnosis, the treatments. But training in accompaniment and communication skills and dealing with the suffering is often occurring in a less conscious and elaborated way. No? So we just copy attitudes or we acquire strategies that we think are useful, but without a formal and structured learning. And usually when I give some bad news to a family, I take a resident with me, and then when we are finished and the family left, I ask him the question, what did you think of the information we just gave the family and how they received it? And big surprise, as expected, they usually answer that they thought it was great. No? But there comes my second question, and why? And usually they do not have an answer to this question, no? Because we do not consciously analyze these acts. I think we do not debrief situations that challenge us personally and emotionally. No? We still somehow maintain the idea that the professionals should not be affected by the suffering of others. No? That there should be a clear line that divides the professional from the personal. We are not taught how to deal with these situations personally and emotionally in depth. No? Even in the healthcare setting, where we are constantly facing the suffering. For me, it's very, very important to understand that behind the disease that is fascinating and behind this pretty technological environment in the intensive care unit, there is a person, a family, millions of circumstances and nuances that make this process of suffering, of the disease, or of dying tremendously personal. No? And in the center of it all, behind all our treatments, the constant humming of the ventilator, the monitors, there is a child, there is a unique and special child. No? And for me, one of the big efforts in my work is to raise awareness that death is part of life, and that we as healthcare professionals should especially be aware of this and learn it formally, no? Not only just unnoticed, getting the best strategies that we copy from others so that we seem are useful, no, to us.
Yep. So as a pediatric intensivist, I'm sure that you see a lot of difficult cases. And one of the things that you mentioned earlier is that you have to take care of the clinician himself or herself after a difficult case. So when you encounter a difficult case, how do you work through those emotions? How do you take care of yourself and the medical team after going through a difficult case?
I've learned a lot of strategies after, 20 years of practice that are very useful for me. I know how I have to deal with my emotions. First, I get aware that they are there, and that it is okay for me to be sad or to be tired or sometimes to feel not comfortable with the things that happen. And I make the space for the emotions. And then I'm also very aware of what helps me getting through them, not only with the team, that's very important. I think debriefing these situations and talking about them, but also personally. I love to go to the mountains, and I have my safe spots where I know that they help me to get through these emotions. I like running, or I like having breakfast Sunday morning with my 3 children. I have 3 girls, and these are like safe spots that I cultivate. And I think this is very important. And also how I'm very aware that what I do, even if the child dies, is very important. And I think giving importance also makes you deal a lot better with these situations.
All right, let's go into your KevinMD article where you tell stories titled "A Dead Baby in My Arms." Now, for those who didn't get a chance to read your story and article, just walk my audience through it and share the story, why you decided to write it.
Okay, I think I began to write down some of the stories that I faced in my intensive care unit practice in a relatively unconscious manner. It helped me to put my thoughts in order and to vent the intense emotions that these experiences provoked in me. And it helped me getting them on track to become a gain in experience and wisdom. So even I think without knowing what I was doing, I began to use this reflective writing as a form of self-care. Very little by little, I also learned to share those often very personal stories where my emotions really were written down. And I became aware that narratives have a very important teaching power. And this fact, together with my awareness that training in the accompaniment and care of the dying is lacking, made me realize that perhaps these stories could be useful to other professionals. And maybe death is the paradigm of a difficult situation for healthcare professionals. But I think in the healthcare professional setting, we all are faced with people suffering, affected by life-changing illnesses and involving lots of times minor or major bereavement situations. And the strategies to care for them are pretty similar for all of them. Particularly, this story is a very special story for me because I think it reflects very well my personal discovery that for me, there is no dividing line between the professional and the personal. And this is why I somehow in the story, I turned from the professional pediatrician to a woman that holds a dying baby in her arms. And I also think that some of the most utterly important aspects of taking care of the family, the non-judgmental attitude. I think we have to step out of our preconceived ideas of what it is best for the patient or how the good death should be, and understand the magnitude of the child's death for the family, accepting their way of coping with it. At the time I wrote it, I shared the story and my perception of what had happened with some of the nurses that had been present. And lots of them told me that their interpretation had been very different, because the fact that the relatives did not want to stay in the unit was interpreted as harshness or emotional remoteness. And the staff felt more detached from the family because they were interpreting their way of dealing with that death as a value judgment. And I think we must accept that there are as many ways of dying as people in the world, no? And in this circumstance, but also in suffering, no? And the important person is the child and is the family. And we must be close with all our medical wisdom, with treating the symptoms, but also validating and accompanying their unique and special way of living that moment, no? And often there are cultural, traditional, or personal differences, and we must respect them and accept them, no? And knowing that this time is so valuable, that we are just orchestrating this unique and particular piece of the child's death, and we help the family discover and express their wishes, and we take care of the child and the family, no? We make it possible that this moment, that is the saddest moment, can be lived consciously, transcendently, and can be remembered, because I think it's always the first step to face the mourning that's coming afterwards and the future life, no? So it's very important to be non-judgmental, no? So I think this story shows how I feel accompanying, and also what I think is very important, just being a doctor, no? To not try to not a judge from who we are facing, no?
As this story, has that changed how you practice and changed who you are as a physician?
I think it was a long way, no? It's not only this story. I think I made a long way before I held a baby in my arms, no? And for me, accompanying the suffering has always been very, very important. And it's kind of a passion. And I've learned a lot, but I think it would be great that it should not only depend on if you like this, or if you think, no, we sometimes say, no, this doctor, what humanity? It's not dependent on my humanity. We all should learn how to deal with the suffering, no? And how to accompany, I think. And it should be a formal training, and usually it is not.
So one of the things that you mentioned earlier was all the technology that is involved in intensive care units, I'm sure not only in Spain, but in the United States as well. So how can physicians retain the humanity in medicine in the face of this increasing use of technology, especially in a critical care setting?
I think it is easy to forget that behind all this technology and the disease now that we are studying and trying to improve treatments, behind that, the key thing about all is the child, child and the family, no? And I think we should personalize, no? It's always another child with other circumstances, and we shouldn't forget that we don't treat diseases, we treat children or adults, but we treat people. And I think that's the keynote, no? And sometimes when the disease is so complex and we have really to face multiple challenges, and it's really important to know that the key point is to accompany. And I think also very important it is to be aware that if a patient dies, we shouldn't feel like we have failed. We can do a lot for the patient and for the family, no? Even if we haven't been able to cure the disease, no? And I think that's very, very important.
We're talking to Sylvia Belda. She is a pediatric intensivist in Spain. Her KevinMD article we're talking about is A Dead Baby in My Arms. Sylvia, for those other intensivists or physicians for that matter who read your story or who's listening to you on this podcast, what can they learn from your experiences in the intensive care unit? What are some of the messages that you want to give them?
Yes, I think for me, the key message is that we should really be aware of what a very, very important role we play in the life of the people we accompany. Not only as doctors or treating their disease, but trying to take care of them and to accompany them in some of the most difficult situations that they are facing in their lives. No, I think to give value to what we do is one of the key points of what I wanted to share with this story.
And my final question, any take-home messages that you want to leave with the KevinMD audience?
Yes, I firmly believe that one faces the suffering of patients as a person, not only as a professional, and that we cannot keep professional involvement at bay to prevent it from hurting us. I think when we face suffering, we are going to feel pain. And that is why I believe that we must find a way in which we can accompany taking care of the patient, but also of ourselves, no? with what they call exquisite empathy, no? In which we are aware of the needs of the suffering child and the family, but also of our own. And we get capable of attending to both. And I think we have a wonderful profession in which most of us are driven by a real desire to care for others. And I believe if we learn to do it well, we can feel an enormous satisfaction and continue to enjoy our profession always, keep learning and growing, both professionally and personally.
Sylvia, thank you so much for sharing your story time and insight. Thanks again for being on the show.
Thank you very, very much. It was a pleasure.